Guys, so today I'm going to be discussing the accessory organs of the GI system. As for the last video, we went over the basic anatomy and how deglutition, swallowing, propels food down the esophagus, stomach, etc., etc. So today I'm going to be emphasizing more on the liver and on the pancreas. These organs are known as accessory organs, but they play a vital role in digestion, including the liver. The liver has many functions, so for you guys to understand what happens when the liver is malfunctioning, you have to first understand what the liver does. You have to keep in mind, and by the way, I separated these organs from the, not the ratio, but I guess proportionally to how close they're supposed to be away from the intestines and whatnot, or the stomach. They're not in proportion, but you guys get the gist. The liver is delivered blood through a really large blood vessel called the hepatic portal vein. So you have the hepatic portal vein, and it's responsible for draining the venous waste from the entire GI tract that begins up in the esophagus all the way down to the rectum. Okay, so you have veins that are actually draining blood from the entire GI system, from the superior portion of the esophagus, all in between the intestines, the stomach, the spleen, and all the way down to the rectum. And so this is important to understand because all of that waste is taken back to the liver. Okay, and you have the hepatocytes, the main cells of the liver. What they end up doing is that they perform a lot of functions, such as synthesis of plasma proteins, immunoglobulins. The hepatocytes also produce bile, which excrete a lot of waste, including salts, bilirubin, amino acids, things like that, right? So the liver receives all of that blood with also the nutrition that it receives from the arterial vessels, so it can synthesize those proteins, so it can take the vitamin K and synthesize it for helping the coagulation process, so we can make more clotting factors. So my emphasis on the liver having this high tract of blood vessels just is based upon the idea that the liver is responsible for a lot of functions. So let's discuss those functions real quick. If we talk about the liver is responsible for the synthesis of protein. Okay, meaning that the liver actually gets the amino acids from protein breakdown, and it utilizes them as the building blocks to create other proteins such as immunoglobulins, also albumin. These are all very important proteins that play a variety of roles in the system. The liver is also responsible for making bile. The liver is also responsible for, including the synthesis of protein, but let's be specific, albumin and globulin. Okay, so it helps create immunoglobulins, and those are responsible for fighting off infections. The liver is also responsible for detoxifying the blood. Anything that's being broken down through catabolism, the breakdown of food substances, it always emits a waste product like ureas and nitrogen and ammonias. And so what the liver does is it takes that blood supply and it filters it out, and it cleanses all the areas, or it converts certain waste into more water-soluble waste, so the kidneys can excrete them. So continuing with the functions of the liver is also responsible for the synthesizing of vitamin K and clotting factors. Okay. Liver is very important for that, so understand that anytime a patient has a liver issue, they're going to be potentially dealing with bleeding tendencies. The liver is also responsible for getting rid of something called bilirubin. Okay, you guys should understand that bilirubin is the waste product of red blood cell breakdown. Once the red blood cells reach their maturity level and lysis has to happen, they have to destroy themselves so that your body can create more. Well, it gives off a waste product. So keep in mind that I'll get a red marker for that. When your red blood cells, when they break down, not break down, but when our body gets rid of them, so they emit this little waste, and that waste is known as bilirubin. And it's important for you guys to understand that bilirubin has a yellow pigment to it. And the liver normally gets rid of that bilirubin via the bile that it produces. So that's why people with liver issues develop jaundice or icterus, because they cannot get rid of the bilirubin that has a yellow pigmentation to it. And that pretty much summarizes the main gross functions of the liver. There's other functions that have to be emphasized as well. However, if you focus on these basic concepts, it generally gives you the foundation for what the liver is supposed to do. So when we talk about liver cirrhosis, you understand the deficits that the patient is going to be manifesting. Continue with the hepatic portal vein. Keep in mind that it receives all that blood supply that the liver has to utilize for synthesis of other elements and things like that, right? We're talking about all the liver properties. Well, when the liver begins to fail, or you develop liver cirrhosis, scar tissue, well, that blood begins to back up, okay? And it's important you guys understand that, because as it starts backing up to where it came from, notice that it's going to go back to the esophagus, and this is where you develop your esophageal varices, okay? So I want you guys to understand that that's why this is happening, because when you have liver damage and the blood cannot make its way through the tissue of the liver, it starts backing up, and that's why people also develop nausea, vomiting, because it's backing up into the GI system, and they also develop something called ascites. And the reason why they develop ascites, a collection of fluid in the peritoneum, in the abdominal cavity, is because the pressure inside the hepatic portal vein increases. So you develop hepatic portal hypertension, and this causes the fluids to spill out away from the vessels into the peritoneal cavity, and that's what contributes to ascites. When people have liver issues, they also tend to develop bleeding issues like spider angiomas and just small capillary bleeds or gingival bleeding. Well, that's because the liver also plays an important role in the synthesis of vitamin K and clotting factor formation, which helps with coagulation. So once the patient has liver issues, the clotting ability may also be impaired. The liver is responsible also for detoxifying the metabolites of food elements that we consume, but also medicine like Tylenol. These medications tend to be hepatotoxic, so you have to be careful when giving those drugs during exacerbation of illness such as hepatitis or liver cirrhosis, because the liver will not be able to carry out its basic function. Okay, so I want you guys to really focus on what the liver does, so we can discuss furthermore what's going to be happening and what manifestations are going to be carried out when somebody has liver issues. Continuing with the accessory organs, I want to focus on the pancreas. The pancreas performs what we call an exocrine function. And when I say the exocrine function, I'm referring to the digestive enzymes that I was discussing in the previous video. However, right now I want you guys to understand that the pancreas itself, it's got these little ducts. Oops, let me get another marker. And these ducts are the ones that are releasing its content, its digestive enzymes, into the sphincter of Oddi, or the ampulla of Vader that you guys are probably familiar with. And it's supposed to be connected to the common bile duct. So technically this bile duct that goes from the liver, where the gallbladder is located, all the way down to the common bile duct and the exit of the sphincter of Oddi, both digestive enzymes and bile is excreted in this portion of the small intestine that we know as the duodenum. And keep in mind that it also releases base, and it mixes with the chyme, with the digestive with the digestive acids, with the digestive food, and also the digestive enzymes, so it can help absorb all those elements throughout the small intestine. Keep in mind that we have the sphincter of Oddi here, which is a muscle that contracts and relaxes to allow that content to be mixing in with the duodenal, with the duodenum and its feces, or the kind that just left the stomach. When you have pancreatitis, what ends up happening is that all the tissues right here in the pancreas, they become swollen, and they prevent the ducts from transporting the digestive enzymes that are supposed to end up in the small intestine. So that's why they start backing up into the circulation, to the capillary system, to the vascular system. And that's why we look at amylase as a serum amylase, as a key indicator that there's something going on with the pancreas, such as in pancreatitis. Keep in mind that the common bile duct shares that outlet from the pancreatic duct, so it can release all those elements. So generally speaking, when people have gallbladder issues, they tend to also develop pancreatic issues because of the close proximity of both of those ducts that are transporting elements that were supposed to be seeping into the small intestine. for digestion purposes and excretion of waste. Okay. Right here, I just drew a little picture of a hepatocyte. Notice that it's got the biliary ducts to create the bile, and it's got your capillaries, your arterioles, and your veins, because what happens is when the hepatic portal vein receives all that blood from the GI system, these are the specialized hepatocytes that carry out all these specific functions that I was discussing. So let's review, folks. Make sure that to understand what happens when people have liver issues, you must understand first what the liver is actually doing. And during exacerbations of of hepatitis, or when somebody develops end-stage liver cirrhosis or liver disease, that's when these manifestations are going to be really emphasized, and you're going to start noticing a more prominent manifestation of those issues when somebody's reaching that peak of the illness. I hope that kind of makes sense, guys. Please follow me on Learn NCLEX now on YouTube and on my other social media. Thank you.